Hello, my name is Stephen Parker. I'm proud to be the chairman of the upcoming Laser Summit in Dubai from the 21st to the 23rd of September 2023. As part of our promotion for this prestigious event, it's my privilege to introduce Josep Arnabat, who is professor at the University of Barcelona. Professor Arnabat requires very little introduction, being one of the pioneers of laser use in dentistry. He is a world-renowned influencer in terms of the use of lasers. And Josep, my first question to you is this. In the light of your proposed presentation on the use of lasers in soft tissue around implants, how do you feel that the daily use of lasers in your clinical practice allows you to influence the outcome in dealing with the restoration of dental implants?
First, thank you, Stephen, for this introduction. I'm very, very happy to participate in this meeting in Dubai in September. And of course, our experience in laser in dentistry is for more than 25 years old when we start in the Barcelona University working in lasers in oral surgery, because I am more focused in oral surgery team here in Barcelona. And of course, now they change about improve our implants and our soft tissue around the implants. And of course, we have many research about this, about the temperature in the implants, about the soft tissues thermal effect, because this is so important to recognize that this is a laser effect, that this is a thermal effect. But if you increase the thermal effect around the implants, it will be possible to damage the implant. And this is so important that the people understand that the soft tissues is so important to maintain in the better position in order to maintain the good healing in our implants. And this is why you promote from many years ago in the second stage of surgeries in implantology using lasers. And this changed my life, because for more than 15 years old, I only use lasers in the soft tissues around the implants. And I think that this is so important that the people understand that it's our follow-up is for more than 10 years minimum. And I will show to you in this meeting what is our results in the follow-up. That is, for me, the most important, that the people understand that it's possible to use laser. Yes, of course. And what happened if I use laser? Of course, it's the benefit for our patients. And this is for me the most important, because in some cases it's more difficult for me to use laser, but its benefit in the patient is better. And it's so high, the benefit in our patients. And this is our focus, our different research about this. And I hope that to show you in this meeting our experience in this field in soft tissues in implantology.
Thank you. I'm sure you will agree that the plural of anecdote is not data, and it is to the credit of your research team at the University of Barcelona that over the years you have supported the clinical outcome of your research by successive publications to support not only the theoretical elements of laser tissue interaction, but also the way in which it can, as you say, benefit your patients. Looking in general at the specifics of healing, outcome of controlling perhaps issues such as pain, microbial contamination, and also, of course, in dealing with suppressing inflammation. You feel that there is a multi-level benefit to be gained from the combination of surgical application of lasers and associated photobiomodulation. What are your views on this?
Okay, this is so important, because the use of photobiomodulation during our treatments, it's so important, because I do surgery with a laser, and when I finish my surgery with a laser, I promote more healing and more benefits using photobiomodulation with the same laser, with another laser, another wavelengths. And of course, when I use in my surgery the laser, I promote a very good healing of the soft tissues and increase the keratinized tissue. When you do the conventional treatment with the blade and you do second stage in surgery, you remove a lot of keratinized tissue. But if you do some new techniques that I promote for many years, in order to maintain the keratinized tissue, it will be possible to use laser in order to promote this. Remember that nowadays, in implantology and in perimplantitis, you need to maintain, if it's possible, the keratinized tissue. If you remove all the tissue around the implant, you lose this keratinized tissue. And this is so important to maintain the keratinized tissue in order to improve the healing in a long time in our implants.
So if I understand, then your philosophy is that first and foremost, you maintain the highest standards of surgery, your clinical skills, and then to augment that high standard with the associated benefits to be gained from lasers. Are there any particular lasers that you prefer in terms of your surgery, or do you feel that this is something that can be extended within the benefits of individual wavelengths? Can it be extended to all lasers? What are your views?
I use different lasers. It's not the only one laser. I use the most lasers that I work in my private office. It's erbium and erbium chromium YGC laser. But of course, it's possible to use a diode laser in order to do this. And I will show in September what is our experience in this. I prefer, in the majority of the cases, uses erbium chromium YGC laser because I have more experience in this. Erbium is possible to do, and we have many cases with erbium, and diode is possible to do too. That means it's not only one wavelength in order to promote this healing around the implants. I hope that it's different possibilities, because it's possible to use 940, 980, 810 diode lasers, and it's possible to use erbium and erbium chromium YGC laser. And I will show you what is the possibilities and what is the real benefits of this. And of course, when I use laser, I decrease the pain in the majority of my patients. That means normally they don't use any analgesic treatment after these procedures. That means I use, in some cases, it will be possible to use no anesthesia, but this is not the most important for me if you use anesthesia or not. I do my procedure normally with anesthesia, because in order to do the movement of the soft tissues, that means it will be possible to create some pain to my patients, and this is not important. Use a little amount of anesthesia, very a little amount of anesthesia. And this is so important that the people understand. Not all the procedures is possible to use without anesthesia, because many people say, no, all without anesthesia, No. If they require an anesthesia, use anesthesia. I am a teacher of dental anesthesia in my university. That means it's easy for me to put some drops with the anesthesia and improve my treatments, and of course the benefits, and reduce the pain to my patients. That this is for me the most important.
Well, thank you very much for this brief sharing of what will turn out to be a fascinating presentation. Thank you very much, Professor Arnabat. We look forward to seeing you and our colleagues in Dubai, September the 21st, 22nd, 23rd. Thank you very much.
Thank you, Steve. See you in Dubai in this fantastic and big meeting. Thank you very much.